Hi, my name is Dr. Ross Hauser, coming to you from Fort Myers, Florida, at Caring Medical, Florida. One of the ways that we objectively document that a person has vagus nerve problem or impulses from the vagus nerve are not normal or hampered or blocked is by looking at people's uvula while they say ah. So when you say ah, what should happen is the uvula stays in the middle. When the uvula deviates to one side, like for instance on this one, the uvula is deviating to the right, it means that the person's levator veli palatini muscle is not elevating the uvula on this side. So it means that this person has less left vagus nerve degeneration, incompetency, decrease in nerve impulses on the left side. The cause of this in most instances is upper cervical instability, which we can document by digital motion x-ray. So when the person has their left vagus nerve isn't working quite right, it usually means that the C2 vertebrae is rotated to the left, which would start compressing the left vagus nerve in the carotid sheath, or there's left C1, C2 instability. The other thing that can cause this is if the person loses their lordotic curve and they have a forward head posture, then that can stretch the vagus nerve. Again, compression of a nerve or stretching of a nerve, or obviously traumatic injury of a nerve, can all block nerve impulses. And when nerve impulses are blocked to a muscle, the muscle doesn't work. So the way that a person can tell by themselves, they can just look in a mirror, shine a light, and see if the uvula is deviated. If you have a whole bunch of weird neurologic symptoms, dizziness, vertigo, swallowing difficulties, change of speech, your vision isn't quite right, your hearing is off, fullness in the ear, migraine headaches, clicking, grinding, popping in the neck stiffness, just look in the mirror and say ah, and see if your uvula deviates. And if it does, you need to get a digital motion x-ray and get prolotherapy to stabilize the cervical spine. And then over time, the uvula gets back to normal, and you know that the vagus nerve is functioning again normally.